So at that point I said, you know what, I don't care, just get it out of me, and I just want to feel better, because I was feeling extremely sick at that point. Signed the papers, went into the C-section, emergency C-section. I don't know how it happens or works, or how it is with a regular C-section. Probably the same, but with the emergency C-section you go in and you get an epidural into your spine. They don't put you to sleep because they don't want to harm the baby, and the death can come in. So first they give you the epidural into your spine, sitting, and once they did that, you have maybe half a minute before you can't move your legs. So you have a half a minute to quickly get onto the bed and lay down into the position. So because after that you're not gonna be able to move. And so obviously they kept checking if I can feel anything, and I don't know, in a couple of minutes or so I wasn't feeling anything from my neck down. Basically I couldn't feel anything, I couldn't move. And that's when the doctors came in, the father came in, and they put up a curtain so I couldn't see anything. And the surgery started, the C-section. And I'm pretty sure every woman who ever had a C-section feels the same, but yes, you're not feeling the pain, but you're feeling extremely uncomfortable when they are cutting you up, opening you up, and like layer by layer they are opening you up, they're forcing the muscles up to get into the baby, and they're cutting the layers. Like, you're feeling it. I said to my boyfriend after, because I couldn't really say much during the C-section, so it feels like you're getting skinned alive, and you feel them opening up your skin, your muscles, your uterus, and just kind of like this tugging, pulling feeling to get it the hole big enough to get the baby out. And also I was told after the C-section that the cord was wrapped around the baby's neck, so that's why they were having a really hard time getting her out, because they had to make sure that she's not gonna suffocate. They had to get the cord off the neck at the same time and getting her out of there, even though she was tiny. But that's why they had a hard time, and that's why they were like tugging so much at my muscles as well. And that's why the baby's heart rate was dropping before, because the cord was wrapped around her neck. Who knows why that happened. As I said, I'm pretty sure it didn't happen before, because I could feel every time her heart rate was dropping, and I never felt that before. That when they got the baby out, she screamed, but it sounded like a little cat, a little kitten, more like a kitten. She was only 780 grams and 34 centimeters long, and that's in pounds. It was 1 pound and 12 ounces, so just below 2 pounds was her weight. I'm gonna use my little book here and see if I missed out on any of the details, but I probably just gonna make another video if I did miss out on anything. If you have any questions, always ask in the comment section, and then I answer back, write you back, or I make a video about it if I missed anything. By the way, if anyone had a C-section, tell me your experiences. How did it feel? How did you feel afterwards? I'm just curious. And also anyone who had a preterm emergency C-section, please write your comments, tell me your story in the comment section. And also if you had high blood pressure during your pregnancy, and if you needed to have a preterm emergency C-section or not, or if you could wait until the actual full term. I'm really curious to see everyone's opinion and everyone's experiences. Anyways, during my C-section, my blood pressure dropped like crazy, like it was like 70 over 50 and so, and that supposedly is also from the epidural, since you can't move and your blood pressure drops. And they were trying to give me something during the actual C-section to keep the blood pressure up, so the baby is gonna do well and don't get a shock of low blood pressure. I remember all that. After the C-section was done, I was taken to a recovery room. They said it's called a recovery room, and I think I was there for an hour, where they just kept checking my blood pressure, but otherwise it kind of let me alone, and I was freezing. It is a side effect of the epidural, but I was so cold, my teeth were chattering, and it was such an unpleasant experience. And interestingly enough, I wasn't even hungry anymore, and the last time I ate was at 1 p.m. and this was at 11. This was already at midnight actually, because she was born at 11:03 p.m. and by the time they took me back to the room, I was close to midnight, and I was up the whole night. Like, I couldn't sleep. I don't know who can sleep. Like, I did nod off during the recovery, in the recovery room after the C-section, but once they took me back to the room and I was back to normal, so to speak, my head was still hurting. I still had nausea. I just had a C-section, so yeah, that's painful. Like, everyone, I'm pretty sure everyone agrees with me that this whole area in your tummy where they did the cut just hurts. Like, every move hurts. Every move, doesn't matter if you move your upper body or your lower body, it hurts. You're always trying to use your stomach muscles, and they can't function, so you're trying to move with your other muscles, but it's not easy. Also, hey, comes with an emergency C-section is that you can't get up for a day, so they put a tube in you, so and you pee in a bag. Like, you don't pee, just kind of just gets all the pee out from you through the tube in a bag, and they actually measure that bag because of your high blood pressure. They need to know if they measure all the fluid intake and all the fluid that goes out of you, because they need to know that everything that you drink or you take in actually goes out of you. That comes with the big blood pressure issue. And because I had that 40-pound weight gain, and lots of that was actually water gain because of the high blood pressure, I was actually most of the, like, I had more water going out of me than I was taking in, that's for sure. For 24 hours I had an IV in with medication, a blood pressure medication, so I was getting basically a blood pressure medication dripping into me continuously for the next 24 hours, and they measured my blood pressure, if I remember correctly, they measured it every 2 hours at that point. Yeah, every 2 hours. I think, just 1 second. So yeah, so here we are. I didn't even say that. Anyways, I think it was every 2 hours for 24 hours, and after the 24 hours it's gonna was every 4 hours. They did give me, I think, some oxycodone for the pain, and they were hoping that it's gonna knock me out, but yeah, I was up the whole night talking to the nurse. Also, you have, for 24 hours, you actually have a nurse staying in the room with you, which I just found very annoying. I'm a bad sleeper. For me, it was basically impossible to sleep. Like, I had the nurse there the whole time next to me, who was on the computer, the light was on, not the whole light, but there was a light on, which I need complete darkness to sleep. I was in pain. I was thirsty, hungry. They measured my blood pressure every 2 hours, and then they gave me medication. Like, they kept waking you, like, if I was asleep, they would have woken me up every hour for whatever reason, because there were so many different medications I had to take at like specific times, plus because they had to measure my blood pressure every 2 hours, plus that 6 a.m. they had to do a blood test, and then at 8 a.m. they give you the food. I don't know who can sleep like that, but basically if you do fall asleep, it's only half an hour to an hour that you can actually sleep before they wake you up, so whatever. But I couldn't see my baby until I was hooked up to the IV, so at this point I still haven't seen my baby, and this is the next day at 8 a.m. where I am now. Yeah, and they give me the food. So the next day was Tuesday, and I had to have the IV in for 24 hours, so until 11 p.m. So I couldn't go and see my baby. I think I nodded off during the day maybe half an hour here and there, but again, they were waking you up every hour, so didn't really make a difference. And then at 11 p.m. they finally took me off of the IV, and I actually told them to please take me off of the bag as well. I want to go to the washroom. So that's when I got up for the first time after the C-section, and that just getting up from the bed, for me that felt like hiking, like climbing a mountain. Like it was so much effort to get up from the bed one day after the C-section that my legs were shaking. I'm pretty sure everyone with a C-section had a similar experience, but it's not just the pain, it's just that your muscles are not working and all your other muscles are trying to take up the extra work, and it was crazy. So that was my first time to the washroom, and it was painful and tiring and hard. But they said that the reason why I really wanted to speed up this whole process, and actually I wanted the bag out, go to the washroom, get up, because they told me if I can finally get up, then I can and don't faint, then I can go and see my baby finally. So that's why I was trying to speed up this whole process. And then as soon as I could, I got up like every 2 to 3 hours to go to the washroom. I had to measure my outtake for the whole time I was in the hospital. So for the whole 4 days I have to measure how much I peed. I had to write down every single thing I drank, water, juice, soup, icicles, popsicle that they give me, everything. So they can measure my intake. After the 24 hours, they only measured my blood pressure every 4 hours, but they still came in every 2 hours to give you some kind of, either to give you a medication or to measure your blood pressure. But at least you had like about 2 hours in between where you could sleep. I still haven't seen my baby because this was at 11 p.m. and the next morning they told me that the next morning I can have a bath or a shower, sorry, and then I can go and see the baby. The reason why they didn't take me right away to the baby in a wheelchair is, first of all, because I was hooked up to an IV for 24 hours, and then after that they were very worried that the blood pressure, when you move, like when you get up, when you sit down, that your blood pressure goes up or drops, and it's very dangerous because my headaches were still there and my nausea was still there, my blood pressure was still high. I was on extremely high doses of blood pressure medications to keep it at a normal level. And yeah, that's why I haven't seen my baby until Wednesday morning, when finally I had a shower. Let me get to Wednesday in this book. I don't think I need this book. Anyways, I finally had a shower and I felt like a normal person. Washed my face, washed my teeth. My boyfriend, during this whole stay, like I stayed in the hospital Monday, Tuesday, Wednesday, Thursday. I left Friday morning, so he was with me the whole time, except when he had to go home. Almost every day he had to go home and pick up something, bring me something that I was missing, or just get me socks or, well, a new bra. So I haven't seen my baby until Wednesday morning, but I started pumping Tuesday evening. They brought me a hospital grade breast pump, again, I couldn't pump before because of the blood pressure. So I don't know, I think I was set up for failing for breastfeeding from the beginning, because first of all, you give birth like 3 months before you're supposed to. Your breast hasn't grown up, not grown, I get it, they grown, but they haven't got to the full maturity for breastfeeding. And then I haven't seen the baby for like, yeah, for more than 24 hours. I didn't start pumping for 24 hours. But anyways, I started pumping at on Tuesday. Not much luck at that point, but still nothing until Wednesday evening when the milk actually came in. But poor boyfriend had to go and bring me all this stuff, and also bra, because once the milk did come in Wednesday evening, well, your boobs are huge and so painful, and you had to wear a bra under the gown because it's just a hospital gown, because it's just too painful. So he was with me, and he also had to bring me lots of food because I was starving. Like, I was just so hungry, and the hospital only gives you food 3 times a day, and there's nothing between 8 a.m. and 8 p.m. and I couldn't go with the reading, so he had to go and bring me lots of food as well. But he did stay there the whole time. He slept on that, there's not a bed, you can't call it a bed, it's kind of like just I can't call it it's kind of like just a mattress in there. But poor guy, no pillows, nothing. He had a pretty hard time there, but he stayed the whole time. I'm gonna talk about seeing the baby the first time and actually what happened to the baby in the next video. I just want to kind of wrap up my hospital stay. So as I said, I left Friday morning. I went in there Monday around 1 p.m. They didn't really want to let me go even Friday morning because the blood pressure just didn't wanna. They wanted you to have a normal blood pressure for 24 hours on a medication before you leave, and also if they change the medication, then again the 24 hours starts from the beginning, and they kept changing the medications. They kept changing which one, the dosage, the timing, and I really wanted to go home because I just couldn't sleep in the hospital. Like, it was crazy. Like, even when they dropped down to just doing every 4 hours your blood pressure, but they are still giving you all these medications, and then you must still have to take Tylenol as well as Advil for the pain, and measure your fluid intake and output. I was just crazy. I couldn't wait to get out of there. But finally I did leave on Friday morning. The only thing I also want to mention in this video is that I did talk to obviously quite a few doctors during my stay, and yeah, they basically just told me the same things, that so high blood pressure, they don't know what caused it, the placenta wasn't working, they don't know if it's the blood pressure that caused the placenta not to work well, or because the placenta wasn't working well, I was getting the high blood pressure. Basically, they don't know anything, they didn't know anything. They don't know if I am going to have another pregnancy, if I would have this issue again or not. They said it's an extremely bad case. Like, my doctor remembered my name, the doctor who did the C-section, like a month later when I went back for a follow-up with the blood pressure medication, because she said it was such a bad case that she will never forget it. And I had to take the blood pressure medication for 6 weeks. Like, I had to kind of, after the birth, I just have to kind of slowly take less and less and less, and get off the blood pressure medication. And I was basically like sweating out water for like 3 weeks after. Like, every time I went to sleep, I was just sweating out water. Obviously, you also have to pump every 3 hours, so that just adding it to the hospital stay when they wake you up every 4 hours for blood pressure check, and then another 4-hour periods for medications, plus you have to wake up every 3 hours and pump. So your breast milk comes, and you want to give your baby obviously the best chance, and they just keep telling me that she needs the colostrum, reverse milk as soon as possible. She needs milk. So it was a really hard stay in the hospital. So from the blood pressure medication, I actually had my legs swollen like that. Like, I didn't have that issue from the pregnancy. I know lots of women have that issue during the pregnancy. I didn't have any. I had lots of water retention inside. Like, you couldn't really see. You could see it. By the time I got to the hospital, you could see it. Like, I could see it, but it was really like everywhere. Like, you couldn't tell that one part was like huge, everywhere. And I had lots of, like, I had at least 10 pounds of water supposedly, because that water went out, that pounds went out in like a week after. But from the blood pressure medication, my feet, not my feet, my whole leg were swollen like this. It was crazy, it was painful. I know people suffer from that, but I didn't have that issue until after the birth. And I think that sums up the whole thing. So my whole experience with the birth. Again, if you have any questions, ask in the comment section and I will try to answer. If I left anything out, I probably left so many things out, but it's okay because they are probably not important. And then I will see you in the next video, and in the next video I will talk about the first time I saw my baby, and from then on we're gonna talk about our experience with the NICU, because she obviously had to stay in the hospital for quite a long time because she was born 3 months early. So we're gonna talk about all that probably starting in the next video, but see you soon. And then, as I said, I will talk about the first time I actually seen my baby.